You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to Capitol View. The U.S. Surgeon General visited the Arkansas Department of Health and UAMS earlier this week. His main message, more Arkansans need to keep naloxone on hand to fight the state's opioid epidemic. Dr. Jerome Adams told an audience at UAMS he believes current partnerships between schools, police, the health department, and more are helping Arkansas's crisis, but he says the state is still falling behind in a major way. The U.S. Surgeon General demonstrated how easy it could be for Arkansans to save a life. Dr. Jerome Adams spoke at UAMS in part to urge more people to carry naloxone, a drug that reverses opioid overdoses.
A person is dying every 12.5 minutes from an opioid overdose, and over half of these individuals are dying at home.
While Arkansas is making strides to end the opioid epidemic, Dr. Adams says the state still stands out when it comes to overprescribing.
Unfortunately, doctors and other prescribers are faced with a choice of either giving opioids or giving nothing. And as a physician, they say, I can't give nothing.
The nation's doctor then praised the state health department for partnering with prescribers to get the word out about these rates and alternatives to pain management, like physical therapy and chiropractic care.
We have to make sure folks are educated about them, both the providers and the public, and we have to appropriately reimburse for them.
Dr. Adams also advised the health department to make its prescription drug monitoring program more user-friendly.
If we make it easier for prescribers, for doctors, for nurses to do the right thing and to check the PDMP, then prescribing will go down.
While lawsuits linger on behalf of the state against opioid manufacturers, the Surgeon General says there's plenty of fault to go around. Manufacturers, doctors, other prescribers, even the patients who demanded opioids, all part of the problem. But he's optimistic they also have potential to be the solution.
We don't want to demonize everyone.
Now, Dr. Adams cautions naloxone is only a Band-Aid to this problem. He says Arkansas and the rest of the country really need to fix a broken system that releases these patients back into society with no direction or help. A member of the audience also asked the Surgeon General his views on marijuana following John Boehner's comments to decriminalize it at the federal level. Dr. Adams tiptoed around that, saying we have to be careful. He was more clear from the recreational standpoint, saying, quote, it makes zero sense for me to say you can't light up a cigarette, but you can blaze up a joint. Here's what he had to say about medical marijuana.
If I'm being perfectly honest with you, there is no such thing as medical marijuana on the federal level. We don't recognize medical marijuana. There are components of marijuana, of which there are over 100, and some of those components have medicinal properties that can help treat pain, that can help treat seizures. There are a number of drugs that have been approved by the FDA that have cannabinoid derivatives in them. And we need to look at marijuana the way we look at any other medication. We need to make sure we go through a process to rigorously determine the good from the bad, to make sure it's appropriately regulated, and to make sure we can honestly say to individuals, I'm giving you something that has a good chance of providing a benefit to you.
And he says that process probably isn't happening as fast as it should. You just heard the U.S. Surgeon General say all parties are to blame for the opioid crisis, from the manufacturers to the prescribers to the patients. But two lawsuits on behalf of the state, one by the Arkansas Attorney General, the other, prosecuting attorney Scott Ellington, are faulting the manufacturers mainly. Joining me now in studio with an update on this litigation is the Attorney General herself, Leslie Rutledge. Leslie, welcome back to the show.
Well, thank you, Jessi. Glad to be on with you.
Some other ongoing litigation that I wanted to ask you about, too, is, of course, medical marijuana. Can you give us an update just on where that stands right now? I know that a lot of patients were disappointed this past week when DFNA came out and said we have to stop scoring the dispensary applications now, too, because of this.
Right. And Judge Wendell Griffin, a circuit judge here in Pulaski County, has essentially put the entire process on hold, stating that the Medical Marijuana's Commission was unconstitutional, that it not it said it, but how it graded the various cultivation facilities. And so while the commission had gone ahead and listed 5 winners, if you will, of a license, his order has put all of that on hold. We are appealing that to the Arkansas Supreme Court. The voters of Arkansas passed this in 2016, and we're defending the Medical Marijuana Commission and to move this process forward.
I know it's hard to even say this or speculate, but I mean, timeline for people at all, or when you personally think medical marijuana could be here?
Well, I'm asking the Supreme Court to expedite this decision, or I will be asking the Supreme Court to expedite this decision. They go on a summer break in a couple of weeks, or not in a couple of weeks, but rather in a couple of months. And so we would hope that they would come back with a decision on this, and the commission, the Medical Marijuana Commission, can move forward after that. Otherwise, it could be months. I mean, when those things go into the courts, it could get hung up for months, and that's why we were disappointed. I know Arkansans were disappointed in Judge Wendell Griffin's decision, and hopefully the Supreme Court of Arkansas will right this wrong.
Since we talked about opioids and medical marijuana as separate entities now, I wanted to bring them together. Of course, a lot of people are saying, why, the opioid crisis, why not fight it with marijuana? Where do you kind of stand on that debate?
Well, when you look at other states who have had medical marijuana available for their residents, it is not something that we're seeing is curbing the opioid epidemic. The opioid epidemic has grown and grown and grown while states have had medical marijuana. Take Connecticut, for example. They had 3.5 million people. Arkansas has 3 million people. We lost 401 lives to the opioid epidemic in 2016. Connecticut, with medical marijuana passed in 2012, it lost almost 1,000 lives to the opioid epidemic. So it is by no stretch of imagination curbing the opioid problem.